Mercy ACO was formed in 2012 to be the population health development arm for Mercy Health Network.
Today we own and operate roughly 8 medical centers across the state as part of our Mercy Health Network system. However, in addition to that, we have rural and critical access hospitals, and in sum total, those equal out to be roughly 50 total hospitals across the state of Iowa.
We do have some consolidation, so some different hospitals and clinics will be on the same system, but I think a common theme for our network is lots of different systems. Because we have so many different systems, we couldn't see the data. I may be able to look up some patient in one system, I could then go look for them in another system, but there was no way to kind of make it a continuous collection of patient data.
The feelings, at least in the initial days, and it really continued since, is a very much a collaborative approach to not only identifying what data sources, collecting data sources throughout our network, but even more so, where do we go next? A majority of our reason for our transition to the Innovaccer product was a lack of transparency in the data and the information and how it was being handled. So with prior implementations of disease registries or data warehouses, we necessarily didn't have transparency in how that data was being handled, how high-risk members were being identified, or even just transparency in the raw data itself.
It's constant evolution because we're learning new things every day that we didn't know before, because now we have the data and we can take that data and look at the outcomes and have a good idea of where the gap is. More and more work has become standardized, but it's also led us to be able to look at where there are different things going on, that we can look at that and compare and say, really, the way they're doing this in Sioux City is the way we need to have everybody do it.
So I think just from an analytics standpoint, we can pretty much run any analysis we want on our population. We pretty much have the full set of EMR data. I can track claims and billing, so we can do pretty much now have a data product where I can take a pretty deep dive at my patients across the entire network. Because before I maybe just knew them for this hospital lens, now I know if they go to any of my other clinics or hospitals.
So we develop processes that should occur at different points in care. So for example, when a patient gets discharged from the hospital and is going back to the physician office, what should happen at that time to make sure that patient has all the resources they need to take care of any issues that come up, to prevent them from going to the emergency department, prevent them from getting readmitted to the hospital. And so we developed a standard set of processes that we want to occur. We built these into Innovaccer so that we know who is supposed to be doing them, and we know who they're supposed to be doing them on and if they got done or not. So now we can track exactly what's being done on these patients, and we can see how that corresponds with outcomes.
I think for the future of care management, I see Innovaccer continuing to really provide a great data solution. You know, bringing good, intelligent technology to bringing lots of data together, and then using all the insights they've gained from working with clients like us to really understanding the best way to treat patients.
Innovaccer will allow us to measure how we're doing in real time, is what I anticipate. Right now, we're able to measure how we're doing 4 to 5 months later when all the claims come in. But I think going forward, as we submit claims, we're going to be able to start tracking those in Innovaccer. I feel confident because Innovaccer has demonstrated they can aggregate data. And this is the key skill that we need from a data company. If you can get the data in, you can do amazing things, and they've shown the ability to get the data into the system.